turbulent waters that none of us have ever been in before. And they're helping us navigate through all this. And my hat's off to them because they're doing a fine job. Also, all of our EMS, rescue squad, sheriff's department, all the health department, the DSS, all the people that are out there working. Just a big thanks to all of them, and the folks at the grocery stores and the gas stations, and it's not the millionaire athletes. They bailed out on us first. It's the everyday good, hardcore American citizen that's out there making things work for us. And my hat's off to all of them. Thank you very much.
All right. Thank you, Commissioner Peel. Anyone else have anything they'd like to report? I would like to say I just wanted to back up Commissioner Peel's words. Our country has not stopped. Our state has not stopped. There's still food going out. People need to be careful. They need to take precautions, but you don't. Said that from the get-go, and all the hard work that the people of Alexander County have done to make sure that the grocery shelves are stocked, not with everything, but they're doing their best. The truck drivers, everyone's out there, our EMS, sheriff's department. It's something we've not seen in our lifetimes anyway. So, the agenda is before you. Do we have a motion on the agenda?
Move to approve the agenda as is.
Second.
Okay, is there any discussion? All those in favor, say aye.
Aye.
Aye. Okay, looks like we have all those opposed? Okay, that sounded unanimous. First on the agenda, public comment. Jamie, we don't have anybody. Okay. So we'll go on to item number 2, which is the public hearing approval of road names. Calling Rick French, County Manager.
Thank you, Mr. Chairman. Tonight we just need to open and then continue the public hearing for road names until our next meeting.
Okay. So we need to open a public hearing.
Yes.
Do we have a motion?
We open the public hearing for the approval of road names, Nest Lane, Oliver's Cove Drive, and Water Drive.
Is there a second?
Second.
All those in favor say aye.
Aye.
Any opposed? Okay, public hearing is open. So we just need to keep this public hearing open till our next meeting.
Yes, sir. That's correct. So
we'll just move on to item number 3 on the agenda.
I think you need to make a motion to continue the public hearing until our next meeting.
Okay. Do we have a motion?
So moved.
Motion. Well, second.
Okay. Any discussion? All those in favor say aye.
Aye.
Aye. Okay. Motion passes unanimously. So we will keep that public hearing open to our next meeting. We will move on to item number 3 on the agenda, which is a COVID-19 update. And I guess we'll let's see here. Why has that got my name on there?
Mr. Chairman,
I'm not opening. Yeah.
we discussed it. Leanne was going to start, and then Doug Gillespie, and then commissioners asked questions, and then I was going to sort of wrap up at the end about what's going on with some of the operations for the departments.
Okay. Sounds good. Okay, Leanne.
All right. Well, currently we still have 2 confirmed positive cases. We want to thank our community. We are very pleased with the response and willingness to do as recommended by our community. I think that shows that our community is taking it very seriously, and we have kept that to 2 positive cases. We do still have several community residents on quarantine waiting test results. Those test results are taking a long time, as long as a week. Which is difficult to wait. But most of these folks are sick anyway. So, but luckily with the new testing protocol, most of everyone that we've got in our community is recuperating well at home. We haven't had to have any hospitalizations from our community that we're aware of. We have been tracking over 60 potential cases, many of which are coming back, most of which are coming back negative. With the new testing protocols, I can't exactly give you total numbers because now the recommendation is if someone is not in a frontline essential position like our law enforcement, medical community, Doug's EMS employees, or high risk in a nursing facility, we are confining them to home to manage their symptoms, and they are improving. We aren't even testing unless there's risk factors. And we're averaging about what the state is seeing. About 3% of our testing is coming back positive, which is 1.8, and we've got 2 cases, so that's kind of right on. The state numbers, you may have seen more than you want to know, but the state numbers as of this morning, that's a moving target. 2,870 cases, 33 deaths in North Carolina. There's currently 270 hospitalized, and those cases are within 89 of the 100 counties in North Carolina. The state predictions is 55 to 6,500 cases by mid-April. So what else did I want to tell you? But we do appreciate our community taking it seriously. I think our small number of cases prove that people are doing exactly what we've been telling them for a long time now. Social distancing is certainly paying off. We currently have about 15 or 20 that self-isolated with symptoms. So we know that too is very low. That's of the people that are tested with the new testing protocol. Those 15 or 20 are following our recommendations and staying home quarantined with their family. We're also keeping their family quarantined so that we are keeping those numbers low. What can I answer any questions now, or do we want to wait till at the end? Let Doug talk about PPE.
Leanne, you've mentioned the new testing protocols. What are those?
The new testing protocols is if you're not in those high-risk conditions, long-term care, have other chronic diseases that we really need to know if this test is positive. If you're a middle-aged, healthy person, we're just telling you to quarantine at home with you and your family. That quarantine is not or, but and. 7 days, you must stay quarantined 7 days from the onset of symptoms and 3 days past fever without using any medication to lower your fever. And for most people that we've been monitoring, we've had a few that have went a little longer than 7 days feeling bad, but most are very mild symptoms, but they still have to stay quarantined 7 days and a minimum of 3 days past fever. It's not and or, it's both of those have to be met.
How many people do we have that are under
We have
those new?
monitored about 60 so far. We still, and I can't give you numbers because the state removed, before we were getting notifications from anybody testing any of our county residents, and the state removed that. I think for those numbers, it was for the big counties. Like Mecklenburg has 733 cases. So can you imagine there's no way their public health department can keep up with those numbers. So probably 2 weeks ago, we were stopped being notified. We're only notified now if we get a positive that was tested, because family doctors have it, urgent cares. So most people are choosing to quarantine at home unless they're very, very sick. If they have underlying chronic diseases, then we do recommend they go talk to their family doctor. Some are testing and some are not. We also do have an adequate amount of testing supplies, so we feel very privileged with that.
So, let me get this straight. So unless you're on a frontline medical or, law enforcement, and they're not going to test you, they're just going to assume that you have it and tell you to stay at home. So
They are. And unless, we will certainly test anyone in a long-term care facility that has symptoms. We would also test somebody that is at risk, like an immune compromised person, somebody with chronic disease that you really need to know because you may need to do something different with their other medical conditions.
So what are the testing protocols if you go to your family physician? Are they going to
They're exactly the
test
same.
you?
Nope, they're exactly the same as for us.
Okay, so our numbers could be much, much, much higher than 2.
I know of about 20 that we have talked to, and we have them on self-isolation. We check in with them, not every day, but every few days to make sure they're doing well and just monitor their symptoms. Everyone has been very cooperative. We've not had any issues with people wanting to leave home before the time's up. We're very proud of our community and our citizens.
And these testing protocols, are they in all counties in North Carolina?
Yes, sir.
Okay. I want to get that information out there that we are not just the only ones doing this. This is statewide.
It's not us. It's a means to conserve the tests that we have. We were not having enough testing. We actually are very blessed to have. We have over 25 tests available right now, the nasopharyngeal, and we have just purchased some rapid blood tests that we're not sure. There's a lot of discrepancy on their FDA approved, but we're running simultaneous studies to see. I'm not sold that they say they're supposed to be 94% accurate, but I'm not sure about that. We ordered them for our frontline staff so that we could have quick, because it's allergy season too. So you have lots of people that get sinus infections and have some of similar symptoms, and some people are demonstrating COVID type symptoms, but without being able to test them, we really don't know. So within doubt, we're telling them to confine at home for 7 days, 3 days past fever.
Well, and my questioning, the reason I'm asking these questions this way is because I've heard people say, "Oh, we've only got 2 cases. What's the likelihood that I'm going to run into those people?" Okay, they're saying the state right now at 55 to 6,500 by mid-April. Those are confirmed cases. So if we're only testing 10% of the people out there, then you can multiply that by 10, and that's how many cases there may be, or maybe more. We don't know. So
you're exactly right. The rule of thumb always in epidemiology, if you know there's 1 case of something, you multiply that times 10, and that's probably closer to accuracy. So you're exactly right. And that's about right, because I know of 20 that we've got on self-isolation. So I think we've gotten 6 or 7 that are past that, and they have done very well at home. I mean, they've, didn't feel great for 3 to 7 days, but certainly wasn't hospitalized, did your normal flu prevention at home, staying hydrated, taking something for fever, and resting, and have done well.
Okay, good. That's good news. All right. Any other commissioners have any questions? Doug, do you want to go ahead and give your report, please?
I can. My office has been working pretty diligently for probably the last 3 or 4 weeks with this. Some of the things that we just instituted, we are doing a pre-shift screening in EMS. We're checking temperatures. We're checking to make sure they're feeling okay. We've even made them come in their personal clothes, and they change into their uniform here, because we want to protect not only our employees, but we want to protect our families' employees also. So, and then when they leave, they'll usually leave their their gear with us here or their uniform with us, and it's either going to be washed the next shift or it's going to be washed by the next oncoming shift for us. So we can try to keep the family safe at home too. Communications, we worked with communications real well. They actually have a pre-screening that they do on every 911 call. The versions have changed 3 or 4 times in that, but it has gone into now that it's actually worked out pretty good. We are mandating that all our employees wear a surgical mask when they go in and make first contact with the patient. And then once they make that decision, that if it is somebody that is possibly COVID-19 susceptible, then they'll get the other person in there and they'll gear up into their personal protective equipment. Couple other things, we've set up screenings, we fit tested our guys, all our EMS guys, and we got about 30% of our part-time completed and 100% of our full-time. We look to the emergency management aspect. Emergency management plays a key role in this because if Leanne needs tests, she has to come through us to get those tests ordered. So we're the ones that are ordering the personal protective equipment. We're also the ones ordering the test, ordering anything. And as you know, there is somewhat of a shortage, but I do believe our county is in good hands right now with the equipment that we have, the personal protective equipment. The only thing I see that we are having problems with is some antiseptic wipes and stuff like that, and we're working on that as we speak. Emergency management's worked with the sheriff's department, getting them fit tested for their N95 mask. Animal control, we've actually gone into hospice and worked with them. MediHealth, Home Health, we've worked with them. Valley Nursing Center. So we have worked as much as we can getting fit tested, and there's 2 fit testers, myself and Mark Howe, that are doing this right now. So we are staying pretty busy with getting them done. We're having some weekend work and everything. Our next goal is our detention center to try to get them for the people that are just doing intakes. So we have had a lot of multiple requests for all sorts of things. But what they're emphasizing now through the state is you're going to get emergency services and healthcare workers that are going to get first priority. We did get some equipment last Friday that we were looking for, and we've got some more stuff on order.
Okay.
And if there's any questions, I'll be glad to answer.
As far as you mentioned the N95 mask, do we have enough, for what we need them for?
I can't say we're going to have enough just because I don't know when that peak is going to hit, if the peak's already hit, or if we still got a while before go uphill to get to the downhill state. We're trying to do everything that the North Carolina Emergency Management, CDC, and Public Health Department say with the mask itself. We look at it, if we put a mask on the patient and we put a safety shield over us and then a mask on us, it's a low chance of communicable disease aspect to it. So that's what we're trying to institute. So we're trying to use the minimum amount of stuff, only need it when we have to do procedures that require what they call an aerosol procedure, where our patient's going to be breathing out or spitting or possibly vomiting or something like that. We've also worked, one thing I wanted to say, we've also worked that if I do have any of my employees or any emergency service personnel that are worried about it, that they might have contracted it or they've dealt with somebody, we have I don't like to call it quarantine, but we have an isolation area that we can use, and that person can stay there for that 7 days plus that 72 hours without fever. There's no visitors allowed. We'll bring them food and stuff like that. So we are worked with that, and that's took about a week or so to get.
Any commissioners have any questions for the EMS director?
I'm gonna make a comment. Doug and Leanne both extremely confident in you guys and appreciative on the job you've done thus far. You've been very proactive up front before we even had confirmed cases. You've done a tremendous amount of work and put in some hours. Also, at the same time, I'm going to commend our citizens for actually taking this seriously and doing some self-quarantining themselves and social distancing. A little bit of help and forethought goes a long ways in a situation like this. And our leaders throughout the county have done a tremendous job as well. And I can't thank you enough for the job that you guys are doing currently and have done.
Okay. Commissioner Peel, were you going to say something?
No, sir. Just
Okay.
thanks. I mean, unbelievable, the work that's been done, dedication, and the service, just unreal.
Okay, thank you. County Manager French?
Thank you, Mr. Chair. Yes, sir, Mr. Chairman. Just to sort of let you know what's going on as far as just to update you about county departments that are either currently shut down. Right now, the senior center is closed. Recreation department is closed. The tag office is closed. Planning, library, GIS. The veterans officer is on call and she's been coming back meeting people. Our maintenance department is working 2 or 3 people, depending on what's going on. IT is having 1 to 2 people here, and 1 is on call. HR has 1 person working. Finance has 2 people working, and has a couple additional people working to help with payroll. Currently, DSS is working about 1/3 of their employees, and they're alternating. Same with the health department. Sheriff, EMS, emergency services are working. Their administrative staff are alternating to try to give us fresher people and also avoid the virus. Administrative staff, there's I'm working, and there's Jamie or Judy are working some. Judy is actually answering the call from home, and both Jamie and Judy are on call. Of course, Jamie's here tonight with us. We're able to forward calls. We haven't received many calls, but I think we're responding. Our tax offices has 2 or 3 people registered deeds. A couple of people are working. 911, of course, is working. Cooperative Extension has a person working from home. Soil and Water sometimes has a person, 1 person or employee that's out. Our landfill and convenience sites are open, and as we all know, if you've been by, they're wide open right now. We're scheduling all this through April the 30th. A couple other things I want to talk about or mention are the parks. We've closed all of our parks, as everybody's aware. The real, I guess, the feedback we get is for Rocky Face Park. Counties and cities and towns in our region, in the COG region, are sort of either, of course, are open or closed in some degree. The reason we're choosing to close at Rocky Face Park is because a couple of reasons. 1, we could only take 10 people at a time in the park. Second thing is we have playground equipment, so no one could play on that. They'd have to be roped off. Bathrooms would need to remain closed. We do have some people that are still going out there and that are walking the trails. Concern the staff has is that if someone is hurt and the park is open, it'll pull emergency service folks out there, and they're really working hard now and working together in this situation. I would like to thank Gary Herman for getting a lot of information out there. We've been working as a committee, Leanne, Doug, Billy, Sylvia Turnmeyer, Gary, Jamie, and I have been working, trying to make sure we organize the information with these code reds. And Gary's been getting a lot of information out there, trying to answer questions. And I think we're learning some good lessons on how to communicate better with the public from this. Main question we have is about Rocky Face Park, and I know some of you are getting calls about it, but I really think right now the best way is to be safe about it. I think it's safe. So I'll be glad to answer any questions about the operations.
Rick, I have a question.
Yes, sir.
It's in regard to, certainly the Rocky Face, you're encouraged to be outside, but to be practicing social distancing. Does you see parks, and people see people on the parkway and other parks where they're just supposed to be keeping the 6 foot apart. Why would Rocky Face have to only allow 10 people in if other places can just keep people 6 feet apart? And they're sort of self-policed on that. I've just actually heard a lot of concern over people wanting to be a Rocky Face. So I shared that I would bring that concern to everyone.
All I can say, I guess, in answer, Jeff, is that, I mean, when people get there, people walk together and they're, visit with each other. And the VMC crowd is a pretty tight knit crowd. There's a lot of people that participate in hiking at the park. We have a lot of people that come from outside the county that also use the park. I've gotten some calls from some of those folks. I mean, we can open it, but I think you couldn't allow more than 10 at a time, because the way, if they gather, we just got to be real careful. We don't get too many people close together. Just last Friday, Brushy Mountain Motorsports, I think, was planning an event, and they were closed because they were expecting a lot of people. And of course, I think they have over 2,000 acres. I just want to point that out. But for us, I mean, we can do that, but I think you got to be careful. If we since it's our property, if we let people go there, it's going to be hard to control that crowd. The last weekend we were open, before we shut down these services, we had about 100 people out there. So we'll, of course, we'll do it however you guys say to do it. I just think at this point, we need to be conservative about it.
Well, I think if we choose to continue on the same path, maybe it's something as simple as just giving a message as to why the park's closed. And that may go a long ways with people. Hey, we got a lot of out-of-town visitors that come. It's really hard to control the social distancing there. It creates a hardship. So maybe if we just shared with citizens, they would understand that aspect, if that's the stand that we, in fact, stay with.
We can certainly do that. We can get something out about it. We could also include that in our next code red if we need to do that, and keep working on getting that out. And then I think we reassess things in a few weeks and see, where we are in this. Because I think the important thing is, we can always adjust to how we need to, and we've been trying to do that.
Thank you.
Yes, sir. Thank you.
Yeah, I guess on that, my main concern would be that, if we open it up, we're one of the only parks around that would be open. And so therefore you're a draw for a lot more people to go there, especially out of town people. That would be my main concern. And I think somewhere along the lines of about half the visitors out there close to it are out of county visitors. So that would be a concern of mine. Okay. Anybody else have any other questions for the health department director or the EMS director or Mr. French? Health and Human Services director, sorry.
Mr. Chairman?
Yes, sir.
I'd like to say, like everybody else, I thank everybody for what they're doing. And I think in relation to the parks, that may be why we've been blessed so far with a low number. We're trying to, keep everyone at a distance and keep things shut down. It's not much fun, but I think, we'll be ahead of the curve maybe if we continue doing this. We've been blessed so far. I'm just praying we have, non-abundance of cases. And I thank everybody, county employees, all our citizens, and everybody for all they're doing, especially our EMS, health department. It's a pretty big strain. Like I say, we've never experienced nothing like this in my lifetime that I can think of, but it's kind of a lot of good things that's coming out of it, you might say, as far as communications and the way things are done. But thank everybody for what they're doing.
Okay. Yeah, and that what you just said brings up another point. We are statewide under stay-at-home orders. It's not, it's not go out to the parks and socialize outside away from people. maintaining the social distance, it's stay at home unless you absolutely have to go out or you're a part of an essential business. So, okay. Anyone else have anything?
Mr. Chairman, I just want to commend our staff for the job they've done. I think they've done just an absolutely outstanding job. They were prepared, and they continue to act on this and to do the things that they need to do to make sure that the employees and the citizens have the information, and that we're keeping our citizens safe. And I don't like staying at home like anybody else. I don't like to stay at home either. But I know that the things that's been implemented, I think they're working, and I want to commend the entire staff and the employees that are involved in making sure that the public knows what's going on. And I think the code red and the information that's being put out is very essential to our citizens. It's a very good job on each and every one of his part. Thank you very much.
Thank you, Commissioner Yoder. All right. If there's nothing else, I just want to say you guys have done a superb job. Everybody's been, I know you've been working hard. I know the public doesn't see everything that, or they see very little of the hard work that is going on behind the scenes right now. So, but we appreciate you, and the results speak for themselves. So, we're going to go on to item number 4 on the agenda, if there's nothing else. Okay. Resolution in support of the North Carolina Consumer and Family Advisory Committee. I call on Rick French, County Manager.
Thank you, Mr. Chairman. The Via Health, who is the mental health provider for our region, is asking for us to support a resolution for what they call CFAC. And CFAC is Consumer and Family Advisory Committee, and it's comprised of people that receive services and their family members. And the resolution just says that we support that system, and they'd just like for us to approve the resolution as presented.
Okay. Do I hear a motion?
Mr. Chairman, I make a motion that we approve the resolution as presented.
Is there a second?
Second that motion.
Okay, any discussion? All those in favor signify by saying aye.
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 Aye. Any opposed? Okay, motion passes unanimously. We will go on to item number 5 on the agenda, daily deposit requirement, exception for up to $500. Calling Rick French, County Manager.
Thank you, Mr. Chairman. Staff is recommending that deposits shall be required only when the monies on hand amount to $500 or greater per North Carolina General Statute 159.32. In the past, we've been requiring much less than that, and this will give us a little flexibility. I want to emphasize we're still being secure with our money and it's being locked up, but especially in times like this, it's good to have a little flexibility, and this will help us.
Okay. Do I have a motion?
Make a motion to approve.
Mr. Chairman, I second.
Is there any discussion? Okay. All those in favor signify by saying aye.
Aye.
Aye. Any opposed? Okay, motion passes unanimously. Item number 6 on the agenda, board appointments and reappointments. Call on Rick French, County Manager.
Thank you, Mr. Chairman. Historic Preservation Committee, reappoint Betty Long for 3 years. Planning and Zoning Commission, reappoint Bud Kaywood for 2 years and Steve Eisenhower for 2 years.
Okay. Is there a motion to approve?
Mr. Chairman, I make a motion to approve.
Second?
Second.
Okay, any discussion? Okay, all those in favor signify by saying aye.
Aye.
Aye. Any opposed? Motion passes unanimously. Okay. Item number 7 on the agenda is other business. County Manager Rick French.
Mr. Chairman, as you all are aware, we have a number of projects that have started or are close to starting. The water expansion project finished. Wittenberg Springs has been finished up. They're still repairing some driveways and doing some landscaping, but that water system has been addressed. Buckeye is moving, crews are moving from there to T-Town Road. They also have to work on Zeb Watts, Liberty Grove Church Road, Dula Loop, Eichard Ridge, and the Polly Bowman area. And when they finish those areas, when we were talking about the project, we actually added some projects. Chad, can you add that list? If you'll recall, we're going to get there. If you'll recall, as we were lining up the water project with Buckeye, we talked about a number of additional water lines. Most of those water lines or water lines would be installed over close to the lake. Sanchez Road is in the Bethlehem area. The rest are over by the lake. And the plan would be, if you approve these, is that we would move from, when they finish, they would move right into this project. What I'd like to be able to do is, if we can, after we can talk about this, is bring a budget amendment to our next meeting. We have funds within the water fund, so this would continue with this. In order for Buckeye to do this project, we need to sort of get this going. We need to do some surveying. There's some engineering work that has to be done. We need to get 35 easements. And so when Buckeye finishes up in August to September, they can sort of roll right into this and we don't miss a beat and we can address these things. It's 1.3 million. It's based on the current unit prices that are being used. As you see, some of the sections, the roads are rather long. They're up to 3,500 feet. So there's numbers of, some of those roads are so to serve with water, and then some of the other ones, Sanchez is only 76,000. I think I'd sent you this information Friday of last week, although that probably seems like a month ago. But just want to, if anybody has any feedback on these things.
A question.
Yes, sir.
$1,113,000, actually $1,380,000.
Yes.
How many customers do we anticipate getting out of that?
I don't think so. I don't think it's a lot at first. I don't think there's 100 customers there, Jeff, but these roads connect to other roads, and so it'll help the circulation of our system in some cases. That's the best way I know how to say that.
Can we have an engineer, someone to meet with us and tell us exactly why they deem this necessary for the circulation?
Yes, sir, we can. All these projects were requested either by some of you guys or by requests that we had from citizens, and you guys had signed off on them. We just asked McGill to provide this information to us. But we can have somebody come to the meeting and talk about them, answer your questions about them. Be glad to.
Yeah.
The need to move ahead would be, and I know it's a lot of money, but to move ahead with these things, we're going to have to get moving pretty soon. And again, if you choose not to, that's fine too. But this is what the costs are for it.
Okay.
We'll
When
ask
do we-
somebody from McGill to be at our next meeting. Okay.
Okay.
And
So I will not have a budget amendment ready for you. Is that what I'm understanding?
I don't know. I would like to have some more information. That doesn't mean that we can't, prove this at the next meeting, but yeah, we want to ask some questions. So
I sent you information on Thursday or Friday that has these estimates and also details about it. And I'll be glad to send it to you again, and also have McGill attend the next meeting. Okay.
Okay.
So, Mr. French, I seen what you got me. I just, looking at the sticker,
Sure.
knowing that we are we're in the process of spending a lot of money.
Yes, sir.
We're also probably in the process of some reduced revenues. But then I also think that we're probably going to be in the process on the back end of all this thing, probably eligible for some, shovel-ready federal type monies that are going to be out there. So, I look at this on several different fronts, and it's not something that I feel like that we need to dive on right now. But we could look at it and assess things and kind of look at the budget and where we're at and listen and see what they have to say. I wouldn't say that it's a negative thing. I just would like to look at it a little bit, I think.
One thing I'd like to say about these projects or the water lines that are listed here, with the contractor, we staff talked when we talked to McGill about, is this something we should bid? It's $1.4 million, say, or $1.1 million to do the water lines. The concern that we have is that if we go out in the environment we're in, we think the bids will be much higher. And Buckeye's already on board. And so it might, if you get all your questions asked, that's why we were approaching it this way. So,
can we put it on can we put an amendment on there? And if they don't like the answers, we can table the amendment.
We'll have an amendment prepared, and then McGill, and then if you're okay, then we'll talk about it, and then you guys decide what you want to do.
And just one question I have: all these funds, even the engineering, all that would come out of water funds, not property taxes. Correct?
That's correct. Yes.
Mr. Chairman, if I may ask Mr. French, these water funds can only be used for reinvestment into water. Is that correct?
Yes, sir.
Very good.
And that's what we've done in the past. I think that's
right.
How we do these things. We've built up our system, but yes, sir, that's correct.
Right, because that's one of the things that we always wanted to do, was to take our water funds and keep reinvesting and keep extending the lines so that our lines would connect, so that it would continue to give the pressure that we needed in order to give the proper equalized pressure throughout the system.
And not to confuse things, but as you will recall, we've actually approved for McGill to do a study of the pressure zones in the Bethlehem area.
Right.
And what that'll probably what the recommendation will be is that we add a fairly large tank in that area, which will be something we may even want to talk about at the time, either going through borrowing money. I'm not sure, or there might be some grant money out there. The idea there is that if there's pressure areas out there we need to address, we want to try to get ahead of the road project, and if we can, because we could save money. We won't, if the road's there and we address it, we may have some line work that has to be done, upsizing, if you will, of some of the water lines. And it's expensive to tear up pavement, and DOT, I'm sure, doesn't want us to do that, but we were just moving. That's something that's on the horizon. But we'll have McGill at our next meeting, and also have a budget amendment for you to consider. I would also like to let you know that the Bethlehem Sewer project is scheduled to start May the 4th. We're very excited about that. That's been a long time coming. Also, we're opening bids tomorrow on the Stony Point Elementary School wastewater project. We're hoping the bids are going to be good. So I just want to mention that. There's some things that I listed in the county manager's report for just topics, but just want to mention those to you so you could be thinking about them. One of the things we're going to have to do at some point in time in the near future is refund citizens for some of the sports that we weren't able to do during this virus. We're also going to have to do the same thing with some of the Rocky Fest fees that we collected in advance. As you guys know, and ladies know, that we are looking at a Partif grant for a courthouse park. The due date for the grant was May the 1st. I received an email today from Partif that said that it's been moved to June the 1st. So again, that's for Courthouse Park, and we have, the elements that we've been talking about for that, but just that's been moved. And that's something we need to talk about in conjunction with the budget. So just want to mention that. We're also getting estimates for Dusty Ridge and Wittenberg. We're working with Duke Energy on those projects, and we'll have estimates really soon. I don't think it'll be by the end of April, but it'll be early in May. So hoping we can get that before you very soon. And just want to ask you, our next scheduled meeting is April the 20th. I don't know if you would want to wait until the 27th of April. Would that cause you any conflicts, or you want to stick with the current plan? If we do April 27th, our intent would be we would try to have public comment during that time in some way. Jamie would either have people contact her, email her public comment, or we could possibly wait till our first meeting in May. I don't know if you want to do that, which would give us more time. And it might be fine for you, everybody here, and we can certainly meet like this, but the budget's going to be a little to do this way. So, and I'm trying to, in the next 3 weeks, I want to have a draft budget for you to start looking at, so we can start talking about it earlier because of all the hurdles that we're going to have. I'm anticipating a more conservative budget than we've seen in some time because of all the uncertainties we have with revenue. So just want to mention that. If we wait till May the 4th, I might could give you a draft then. So I don't know if I'll have one ready by the 27th of April or the 20th. I sure won't have one ready by the 20th. So I'll just say all that. I don't know if you had your heart set on if we meet on the 20th. I think on the April the 20th, this meeting would be similar. We just talk about where we are with the process that we have going on with dealing with the virus. We'll certainly keep you informed and keep sending you emails. So,
Mr. French, it'd be my preference that we had a meeting on the 20th, just because we're in unprecedented times, and I'd like to hear directly from the health department people and the EMS people, and I think the public want to hear that too. So
okay, I just want to offer that. That's all.
I understand I don't like any more meetings than I have to go to, but I think we need to stay in communication together as much as possible as a group.
I agree.
I don't know how the rest of the guys feel about it, but
I definitely agree. I do want to go back to one thing that Mr. French mentioned that I'd like to see this board take care of possibly, and that would be to refund out to our citizens on any funds they paid in for rec for their kids. There's families out here with one child, 2, 3. I mean, that's well over $100 right there. So there's no need, in my opinion, for the county to hold on to these funds.
I would agree. I think we need to get those back as soon as possible, and it's also the vendors out at Rocky Fest because those guys have been shut down. They're doing nothing right now, and they may that may mean difference between something. So
we with Rocky Fest, I won't say that's simple to do, but we'll certainly do that. And like I mentioned with the rec, the race that we had, trail race that we had scheduled, we offered folks the opportunity if they wanted to sign up for another race or they wanted to refund, and we've had a couple people ask. So I'm just making you aware, and we will get that as soon as we can. Right now we are very short staffed, but we will do it pretty soon.
Rec would entail spring sports, correct?
Sir?
Rec would entail reimbursing fees paid for spring sports?
Yes, sir. Yes, sir, it would.
Yeah, I think that would be a really good thing.
I just wanted to make sure everybody understood that our plan was to do that. You may be getting some comments by citizens, and we've told them we will. If you'll be patient with them, we'll get to you soon. So we don't want to hold their money, like Commissioner Pennell said. You could have 2 or 3 children from one family, so it'd be quite a bit of money.
Yeah.
So that's all I have. I have couple things for closed session, Mr. Chairman.
Okay. We'll move on to consent agenda. Do we have a motion?
Mr. Chairman, I move to approve.
Okay. Is there a second?
Second.
Any discussion? Okay, all those in favor signify by saying aye.
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 Any opposed? Okay, motion passes unanimously. We will go into or we will, I make a motion that we go into closed session for North Carolina General Statute 143-318.11, Section A 4, 5, and 6 for economic development, contractual, and personnel. Is there a second?
Second.
All those in favor signify by saying aye.
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 Aye. Any opposed? And we will adjourn simply to re-adjourn. And if you would, please wait till everyone is off this video call before we start discussing anything.